It's a difficult conversation, but an important one, because every 11 minutes an American dies by suicide. I'm Tisha Powell.
And I'm Lee Zurich. We're going to be talking about it throughout this story, so we want you to know help is always available via the phone or text to 988.
According to the Centers for Disease Control, in 2022, suicide was responsible for almost 50,000 deaths.
Depression and other mental health concerns are among the complicating factors involved in suicide and suicide attempts.
For those who face the most serious cases of depression, relief could already be on the horizon.
A drug used as an anesthetic for decades is getting fresh consideration for its potential mental health benefits.
Reporter Kristen Crowley explains why experts say ketamine could be the answer.
Can an anesthetic pull people from the depths of depression? There's growing evidence it can.
There are many medications that are used off-label, and this is one that has been wildly successful.
While the FDA has not approved ketamine for psychiatric use, clinical studies reveal most participants saw a significant decrease in symptoms after just 24 hours.
60 milligrams of ketamine,
including Nell Katie, once planning her suicide, saw immediate effects.
The experience is the feeling of floating for me. For me, very serene.
At this ketamine clinic in Savannah, Georgia, experts say the dose is highly regulated and most effective when paired with talk therapy.
This is a means to an end. It's not an end in itself. We're not just doing this for fun. We're not just doing this to have a brief feeling of being better or feeling better. This is really in order to work on understanding the underlying issues.
In 2019, the Department of Veterans Affairs announced it would offer this breakthrough drug.
And here's why that's important. Veterans make up 6% of the population, yet account for 22% of suicides.
But 5 years after the decision, we found just because the VA offers this treatment doesn't mean it's available to all veterans who qualify.
Reporter Meredith Anderson explains why.
I've spoken to people who say, no question, ketamine saved their life. But I also found a staggering 86% of VA networks do not offer ketamine treatments. So if the government isn't stepping up, who is?
Jason Pierce has a lot of photos from his 2 decades in the military. First, he joined the Air Force. When he retired, he was a major in the Army. His pictures paint a picture of success, promotions, higher education, travel, friendship. But in those pictures, his smile became part of his camouflage.
Do you feel like you have some trauma from your time in the military?
Yeah, definitely. I was diagnosed with PTSD and given disability kind of on my way out.
Jason's wounds were deep, but he never saw traditional combat. As an Army social work officer, he was embedded with each of his patients on their own private battlefields, helping them navigate everything from sexual assault to losing limbs to losing battle buddies, either to enemy forces or to suicide.
I've been taking on other people's trauma my entire military career.
As he was taking pictures of his own experiences, he was also saving mental snapshots of his patients' experiences. And over time, it became a dangerous scrapbook known as vicarious trauma.
You're working just pushing and pushing and pushing to help everybody else that you forget to help yourself.
The Department of Justice warns those who work with victims, law enforcement, EMS, firefighters, and people like Jason are particularly at risk of vicarious trauma due to their continuous exposure.
There's just not enough mental health care out there.
As a nurse practitioner, Lauren Bursey saw it firsthand in military hospitals.
A lot of patients I saw for knee pain, and I'm like, we have way bigger problems than the knee pain. And so I would refer those patients to behavioral health.
But the military is notorious for long wait times and a shortage of behavioral health providers. So Lauren wanted another option for her patients. Enter ketamine.
Have you ever seen something work this well?
For this, no, not at all.
But not every VA offers IV ketamine therapy. We found only 24 of them do. Augusta is not on that list. Only one in Georgia offers it. None in South Carolina do. The VA's own website says its top clinical priority is to prevent veteran suicide. Yet years after the VA approved it to treat severely depressed veterans, only 14%, 24 of the nation's 172 VA medical centers, can offer IV ketamine. Instead, people like Lauren are stepping in and opening private clinics.
I feel like this can help a lot of people.
Then why isn't it more widely available? Why are you the only one in Augusta?
I will say ketamine has been a bad word for a long time.
Most recently, because of Matthew Perry, his cause of death, the medical examiner ruled, the acute effects of ketamine. Perry had been treating his depression and anxiety with ketamine therapy, but levels found in his autopsy were enough to knock him out for surgery, far exceeding levels in his treatment. Ketamine abuse is nothing new. For decades, Special K was known as a club drug popular at raves. It can cause hallucinations and has been used as a date rape drug. Lauren says, don't confuse that with IV ketamine therapy, where the ketamine is highly regulated, unlike the street drug. It's also given in her office, a highly controlled setting where the patient is monitored, and the dose is small enough that the patient is still in control.
I mean, I have a guy who's 21 days sober and hasn't been in 7 years. It's a big deal.
Which brings us back to Jason. After getting the help he needed, Jason went back to helping others as a therapist out of the Army. He wondered if ketamine therapy might help him and some of his patients, so he made an appointment with Lauren.
As soon as I came out of that first session with her, I took the eye mask off and I said, everybody needs access to this. Everybody needs access to this.
The recommended protocol is 6 infusions in 28 days, but Jason says he saw an immediate and life-changing effect after just one.
I don't want to say free, but free.
Really?
Really. Yep. Having to have a pill caddy for morning and night to no medications.
No medications means no side effects. So Jason says he can be the best version of himself at work with his patients and at home with his family.
The VA also offers S-ketamine. It's a nasal spray. We found 30 locations offer that, so it's more accessible. But still, that's only 17% of VA networks. The VA has something called community care, where private healthcare providers step in. Lauren, whose husband is a veteran, is trying to get her clinic, Elevated Health, on that list. She says she's also applying for grants in hopes veterans don't have to pay out of pocket for treatment. In Augusta, Georgia, I'm Meredith Anderson.
Again, if you or someone you know is struggling, you can call or text the National Suicide Prevention Lifeline at 988. It's free and available 24/7.
Still ahead, hackers can use Bluetooth to take control of your phone. We'll tell you how to protect your most personal possession.